I'm going to introduce our next speaker, Dr. Valentina Medici. She's joining us virtually live from UC Davis. She's actually on call covering the inpatient hepatology team today. So thank you, Valentina, for joining us. So Dr. Medici is she's a professor of medicine at the Department of Hepatology at UC Davis Medical Center. She's a world-renowned expert in Wilson's disease, actually. Her research and clinical focus really focuses on rare disorders, and particularly the role of nutrition and liver health overall. So she would be presenting today her talk on nutrition for PSC. Valentina.
Okay. I hope you can hear me and see my slides in the right mode. I'm assuming that's the case. Well, I would like to thank the PSC partners and, of course, Dr. Imam for the kind invitation. And I apologize, I've not been able to join in person. I have to cover the inpatient liver service. And as you can imagine, I would like to be there in person by far instead of being here. With that said, yes, I'm a hepatologist here at UC Davis, and I focus, among other things, especially on nutrition in patients with liver disease. Let's see. All right, I hope I can progress. Here we go. Okay, so before we take a deep dive into the specific recommendations, diet recommendations, and eventual interventions for patients with PSC. I would like to start saying that when we make specific, dietary choices and recommendations, it's very important to keep into consideration the stage of the liver disease. And of course, also patients will have to keep in mind the presence of associated conditions, of course, IBD, but also others like obesity and diabetes, and of course, age, and be mindful of the cultural background and preferences. So, of course, when talking about PSC, there will be, and particularly again, dietary choices and advices. There will have to be a strong consideration of the stage of the liver disease, because there is, of course, great differences between the PSC in the initial phases, when there is very mild disease, and then, of course, when there is the development of cirrhosis, portal hypertension, and eventually, of course, consideration about the post-liver transplant. So with that said, starting from patients with PSC in their early stages. So here the recommendations will be really like very similar to the general population. So about a healthy lifestyle, healthy dietary choices. We really know specific restrictions, and not because I particularly like to mention numbers and calories, but nowadays we can calculate calories with the app and trackers. That's very easy. But and in patients with PSC in the early stages, we need 25 to 35 kilocalories per kilo a day as a calorie requirement, which is to maintain the body weight, which is like any individual in the general populations. And the dietary choices will be, the best choice is always like the Mediterranean diet. So favor whole grains, monounsaturated fats, like we'll go a little bit more in detail about this, but olive oil, olives, nuts, and stay very low in processed food, refined sugar, and favor lean proteins, and particularly, of course, plant-based proteins. So now we'll go a little bit in the detail of the pathophysiology, why diet can be particularly challenging in patients with PSC. So, of course, we have heard many times this morning about the connection about the gut and the liver. And as you can see here, I would just, as a reminder, this is a representation of the got here this pink cylinder, which is connected to the liver through the portal vein. And this is part of the circulation or recirculation, what it's called the enterohepatic circulation, which involves also bile acid. So what happens in PSC, that is this recirculation is disrupted. And that is important because basically the bile and the bile acid are involved in the fat absorption and digestion. So what happens in PSC, like in other conditions with cholestasis, so there is basically a reduced breakdown and absorption of fat in the intestinal tract. So there is a clear predisposition to fat malabsorption and deficiency. But again, that happens particularly in more advanced stages of liver disease. So what happens in PSC is that there is really a perfect storm of situations that favor malnutrition, and that include the reduced fat absorption, fluid retention, sodium retention. That happens again in more advanced stages of liver disease, reduction in the protein production, and also dysregulation in the blood sugar and sugar metabolism. With that said, patients with PSC, especially again with advanced liver disease, are particularly prone to malnutrition. And why is that so important? Because malnutrition really in any condition, in any disease, particularly in patients with liver disease, it's associated with poor quality of life, but also mortality and increased risk of complications or any manifestations of advanced liver disease. Particularly, we are concerned about sarcopenia, which means the loss of muscle mass, and which is per se it's associated with higher risk of mortality, particularly also among patients, among liver transplant patients. And it is often particularly also difficult to diagnose malnutrition, and often it's kind of overlooked unless it's very advanced. And we are becoming, although currently basically the diagnosis of malnutrition is often based on the physical exam, really a good physical exam essentially can diagnose malnutrition. But I just want to mention that we're becoming better at diagnosis and quantifying malnutrition and skeletal muscle loss. For example, this is how this probably is becoming part of a clinical practice. For example, the measurement of the size of the psoas muscle. As you can see here, this is a transversal section of a CT scan. And this is the psoas muscle, which is a thick muscle that support the spine, basically. And you can see here in the panel B, how psoas muscle is pretty thick. And in patients with advanced liver disease on the panel D, it is much thinner. And this is associated with increased risk of mortality. So to be more specific about recommendation, diet recommendation in patients with PSC and advanced liver disease. So again, it's a perfect storm because these patients will have decreased oral intake, often with reduced appetite, change in their the taste, but due to also decrease intestinal absorption, decrease fat absorption, and at the same time increase energy expenditure. So you just can imagine, just to give an idea, is that patients with liver disease and advanced liver disease burn calories very rapidly. So basically, as you can see here, the full sources used by patients with cirrhosis after 10-hour fasting are the same as a 3-day fasting in the subjects with a healthy liver. So basically, prolonged fasting is really detrimental for patients with liver disease because during a prolonged fasting, patients will start to burn calories and essentially burn their fat and their muscle much faster than a healthy individual. So first, very practical recommendations. who doesn't like to hear recommendation about, from your doctor to eating a nighttime snack? So this is what we really recommend to patients with liver disease, to have your nighttime snack that is especially protein-based. So for example, a 350 calorie snack, protein-based. And just to give an example, for example, a Greek yogurt with some honey, for example, it could be a great choice. Of course, we have to be a little bit mindful here if you have diabetes, for example, or if you have heartburn or GERD. Of course, having a nighttime snack or just before you go to sleep might be a little bit bothersome. So just be careful about this. However, generally speaking, patients with liver disease highly benefit for a nighttime snack, especially, again, protein-based. And this has been associated by multiple studies with helping increasing or maintaining the muscle mass. So going a little bit more in detail again about the calorie requirements, if a patient with a PSC in early stages will need 25 to 35 kilocalories per kilo a day. Patients with advanced stages of PSC will need more calories, and that again to maintain especially the muscle mass and the fat mass to 35 to kilocalories per kilo a day, especially with the increased requirement of proteins, which is for an individual with a healthy liver will be about 1 gram per kilo of day of protein. With advanced stages of liver disease could be up to 1.5, sometimes 2 grams per kilo a day. So a summary of these, some golden rules for you. Small and frequent meals is a recommendation, making sure that you don't have prolonged fasting time. So make sure that have your snack before going to sleep, and then have something, do not skip breakfast as something as soon as you wake up. Again, the bedtime snack, early morning breakfast, high proteins, especially plant-based protein, avoid skipping meals, and of course, low sodium diet when there is also fluid accumulation and eventually ascites. So some recommendations on the base of proteins here. These are information that can be easily found, but of course, select high biological value sources. So egg whites, very rich in proteins, which is of course could be a good choice, because if there is fat malabsorption, egg whites are particularly rich in proteins and very low in fat. Milk, yogurt, Greek yogurt is a great source of protein, cottage cheese, and then of course chicken, fish, turkey, and do not favor red meat because it's also very loaded with salt. And other good sources of protein, of course, beans, lentils, and whole grains, but also like quinoa, wild rice, and nuts. Some fats are, of course, better than other. So we recommend these monounsaturated and polyunsaturated fats. We also here we have to be careful because like sesame oil, flaxseed, canola oil, peanuts oil, in general, these are good, but we also have to be careful because nowadays these oils are also usually included with highly processed food or super processed food. So these are particularly good if you cook for yourself, and these are not part of processed food themselves. And so in general, limit unhealthy fats, like any general population to do. Some very practical recommendations. So when we're talking about, reduce or challenges with fat absorption, we're also talking about fat-soluble vitamins. So these vitamins, so vitamin A, D, E, and K, are vitamins that are fat-soluble. And so that means that these vitamins in particular can be particularly challenging to be absorbed by patients with PSC. and cholestatic liver disease. And that can result in deficiencies. So vitamin A, for example, sight problem, visual problem, or skin problem. Vitamin D, of course, osteoporosis. So there are some vitamin preparation, and I don't have any commercialization, but this is a good one, that are particularly designed to help with this vitamin absorption. These have to be prescribed, but this is particularly because this is a formulation where the vitamins are included in this hydrophilic exterior, which make the vitamins much easier to absorb. So keep that into consideration and eventually ask to have this prescription. Another source, a good source of fat, or a good way to easily absorb fat, is to take these medium chain triglycerides. So these are, they come in oil that it's available over the counter. Any major pharmacy will have their preparation. There are a lot of formulation of these out there on Amazon, for example. And this is basically, these are triglycerides with the fatty acid chain that is shorter than the long chain triglycerides, which is the one that it's normally present, in the dietary fat. And this makes it these triglycerides particularly easy to absorb. They're soluble in water, and it can take maybe 1 or 2 tablespoons a day with a salad, for example. The taste is not great. You have to kind of adjust to it a little bit. But if you take in a small amount, again, will help with the fat absorption that you need if you're having that challenges with the advanced liver disease. The other complications that actually I think we heard about earlier this morning is osteoporosis. That it's particularly, we call it hepatic osteodystrophy. So this metabolic bone problem that it's particularly associated with liver disease. And to prevent that, the recommendations is to continue with exercise as much as tolerated, no tobacco smoking, no alcohol, of course, and vitamin D and calcium, and eventually biphosphonate. One thing that we really like to recommend a lot these days, really for any patient with liver disease, is coffee. And I'm talking about, black coffee or espresso. Unfortunately, no much addition of, creamy or sugar. But there is a lot of epidemiological evidence that coffee is good for the liver. This study in particular is actually also for, particularly for on patients with PSC, and that it's been seen that the association, there is a negative association between the lifetime use of coffee and PSC, meaning that the more coffee, the less the risk of developing PSC. So this is not about the progression of PSC or the progression of complication of PSC, but there is very strong epidemiological data. So nothing wrong with take your coffee. Again, I'm talking about black coffee, 1 or 2 cups a day. If you could take it, that is very beneficial for patients with liver disease. And we can see that also some negative association with the PSC. So other recommendations, question that nowadays we hear all the time. Intermittent fasting, extremely popular nowadays. For the reason that I just mentioned, fasting is particularly detrimental in patients with liver disease, so not recommended, especially in patients with cirrhosis. Gluten-free diet, no, again, just to mention something that it's particularly beneficial, or in general. There is one study that just came out showing that there is no clinical improvement by following this diet in patients with the PSC and IBD. Although in this study there was some improvement of biomarkers of intestinal inflammation, still no formal recommendations that we can make. There was actually a trial on curcumin, and also that didn't show any clinical improvement in PSC symptoms or even blood test. For the post-liver transplant situation, aside from, again, recommending, making recommendations about healthy lifestyle, which can be particularly challenging in the post-liver transplant setting, we stay more on the avoid raw food or shellfish, avoid grapefruit juice due to interaction with the tacrolimus, and in general, healthy eating. And some final messages is that my recommendations is general to follow healthy lifestyle, avoiding processed food. Diet per se won't change the course of PSC, at least to our current knowledge, but healthy diet can definitely protect the liver from additional stress and inflammation, avoid fat accumulation in the liver, which can still happen, and control symptoms of fatigue and nausea and help with the general well-being. With that said, this is my last slide, and I will stop sharing here, and I think we're moving to other session.